Hello again. Today is the new topic, and it will be about three other infections: tuberculosis, diphtheria, and pertussis. There are some common features of these infections, so let's start. And we will start with tuberculosis. Tuberculosis is an infection which is caused by bacteria. Usually, the mostly common bacteria causing tuberculosis is Mycobacterium tuberculosis, but we have some more species which are causing different infections, including tuberculosis, and here you can see classification of Mycobacterium genus. It includes Mycobacterium tuberculosis complex, non-tuberculosis Mycobacteria, and Mycobacterium lepra. First group will cause tuberculosis itself, and it includes more species, so not just Mycobacterium tuberculosis can cause this infection, but this one is the mostly common and the mostly characteristic for, and the mostly severe in case of tuberculosis. Second one is non-tuberculosis Mycobacteria, and this group of bacteria is usually causing skin infections or intradermal infections, and Mycobacterium lepra is causing leprosy. But the main bacteria, the main disease we'll discuss tonight is tuberculosis. Moreover, this classification of Mycobacteria includes rapidly growing and slowly growing Mycobacteria. So slowly growing Mycobacteria can grow about between 4 and 16 weeks, and rapidly growing Mycobacteria is growing between 7 and 10 days. Well, Mycobacterium tuberculosis complex is making part of slowly growing bacteria. Even if sometimes it can grow between 15 and 25 days, but very often it can be up to 4 weeks. So we will not have too fast cultivation of these bacteria. Transmission of tuberculosis is well known. Probably every person you could ask about how this infection is transmitted will answer that it is an airborne infection. So, pathogen is Mycobacterium tuberculosis or others. Source of infection is human, less animals, so it is zooanthropootic infection or zoonosis. But usually it is spread between humans. Mechanism of transmission is airborne. It is airborne infection, and way of transmission, air droplets. And of course, factor of transmission is saliva, mucus, sputum. We have two clinical forms of tuberculosis: primary tuberculosis and secondary tuberculosis. Primary tuberculosis is associated to primary infection, and usually it can happen in the young person in young age, and very often such infection doesn't requires the specific treatment. It can occur like a simple infection. It can affect local lymphatic nodes. It can produce some hemorrhagic reactions, and it can disappear like disease spontaneously. So either the organism will be able to treat it by itself and will eliminate bacteria from the body, either the bacteria will be encapsulated, or not encapsulated, like not in capsule, but it will be covered in calcificated spots, in the body, so it will be covered actually with calcium. So it can be as a dormant bacteria during years, maybe decades, until another pathological process could destroy this coverage, and the bacteria will cause a secondary infection. Well, secondary tuberculosis can be associated either with reappearance of infectious process by the same bacteria, either after the reinfection with from another source. Talking about laboratory diagnosis, of course, we will take specimen from affected area. The best sample is sputum. Anyways, it is not the mostly comfortable getting sputum as specimen for investigation, since it includes several issues, like it gets in danger the health of the medical staff which collects the specimen. Moreover, it can be complicated to get some bacteria from the sputum, since this material is not homogeneous. But anyways, it is the mostly spreaded way of culturing of bacteria. Culture media, the mostly used culture media for diagnosis of tuberculosis is Levenstein-Jensen, and the results could be within 2-3 weeks, but sometimes it can be up to 4 weeks. So the results are not that fast. It is slowly growing bacteria. We have several levels of service for diagnosis of microbiological labs, which are very important in case of diagnosis of tuberculosis. And since it is a very complicated process, it takes a lot of time. It requires a lot of work. On the microscopy, you can find Mycobacterium by using the Cell-Nielsen staining or acid-fast staining. Even if Mycobacterium tuberculosis is considered to be gram-positive bacteria, it is quite almost impossible to stain it by gram staining, since Mycobacterium genus has outer layer which is composed of teichoic acid, and in more simply, it is a kind of waxy layer, which doesn't give access for acids or alcohol to get inside the cell. So it becomes really complicated to make staining with such common type of staining as gram staining, since none of dyes in gram staining will be able to get inside of the bacteria. This is why we have Cell-Nielsen staining, in which the principal part of staining is heating of the smear. So we are making the smear. We introduce the red dye, few droplets of red dye. It is fuchsin, watery fuchsin, and these droplets of the dye are to be passed through the flames, but not boiled, just passed through the flames until evaporating will start a little bit. So this temperature will increase the increase the permeability of the bacteria. The waxy layer become moist, and the dye will be able to get inside the cell. But it is important to not boil the bacteria, otherwise it will be destroyed during the staining. So after making this heating of the smear, we let it cool, we repeat the procedure, and we introduce the smear in the 5% H2SO4 sulfuric acid. And after that we add some blue dye in order to make difference between acid-fast bacteria and other bacteria which could remain, or other particles which could remain in the smear. But we have one of the mostly universal types of diagnosis, which basically can be applied to, if not to all of infections, probably to the majority of infections in the lab diagnosis, and namely it is polymerase chain reaction. And the principle is included in the fact that the DNA of the mycobacteria is able to actually the cells of the oral cavity of epithelia are able to catch and to take inside the DNA of Mycobacterium, and after by the taking of the oral swab, we can find the DNA of tuberculosis of Mycobacterium in this swab. So it is kind of easier, faster, and more safe ways of diagnosis of tuberculosis. Regarding the prophylaxis and treatment, of course, it is very important to have both specific prophylaxis and non-specific prophylaxis. And in the majority of countries is applied specific prophylaxis, which includes BCG vaccine, which is actually not a vaccine against Mycobacterium tuberculosis itself, as the mostly common cause of tuberculosis in humans, but this vaccine is made of the Mycobacterium bovis, which is less aggressive bacteria. It is able to produce tuberculosis in humans, not that often. Usually this bacteria is producing tuberculosis in cattle, namely in cows. This is why it is called bovis, from Latin bovis, which means bull. So actually the principle of action, of BCG vaccine is to decrease the severity of infection, the disease, in case of getting of an infection with Mycobacterium tuberculosis. But it will not protect 100% against infection with Mycobacterium tuberculosis. This is why some countries, especially high-income countries, decided to not use this type of prophylaxis, since tuberculosis is known as so-called poverty disease. So usually it affects poor people with low incomes, people with from the lowest social layers. And in some countries it were decided that it is much easier to fight with the social background of this disease, and it is much efficient and much better for society to fight with the social background of this disease, and less with the pathogen itself. Talking about prophylaxis and of course talking about treatment, it is also includes some medical and some social programs. And of course talking about non-specific prophylaxis, It includes as well better hygiene and healthy lifestyle. It was proven that two similar persons infected with the same infection of tuberculosis, one of them would have active lifestyle, healthy lifestyle, and another one could be even wealthy, could have all the required goods, but to not be active enough, to not have a healthy lifestyle and healthy diet, rich in all the nutrients. And the mostly active and healthy person will have less chances to get tuberculosis. So it is very important to be to have everything, at least minimal goods, or if not to be rich, if not to be wealthy, and to be active, to have active and healthy lifestyle, healthy diet. Regarding the treatment, before we apply the treatment, it is extremely important to make checkup for drug resistance, since tuberculosis is well known as one of the mostly spreaded multi-drug resistant pathogen. Since this bacteria has from nature some factors of resistance, it can persist in the environment for about 3 years in dry conditions, and it will survive. But in humidity, it can persist even longer, and this is why the bacteria is that aggressive, that if it has that big persistence in the environment with low level of comfortable conditions for this bacteria, for multiplication of this bacteria, in case it will get in the human's body, it will be even more complicated to kill the pathogen with common medicines, with common antibiotics. This is why we have specific antibiotical treatment for tuberculosis, which includes several drugs at the same time. But anyways, before we'll apply this complex antibacterial treatment, we have to make a checkup for resistance. And one more important side of the tuberculosis therapy is DOTS, so-called DOTS, which means directly absorbed treatment or directly absorbed therapy. And simply it means that treatment of therapy of tuberculosis is to be directly absorbed by a physician. Like, you are not giving the medicines to the patient and you are prescribing the treatment and the patient is going home and is following the treatment. But it is extremely important to make this directly absorbed treatment, which means every single pill of antibiotic against tuberculosis will be swallowed, will be administered in presence of the doctor. Why is that important? Since, as well as we know, the mostly affected population is population from the vulnerable social layers, and usually among them we have alcohol addicted people, we have drug users, we have people with extremely low immunity, with extremely low level of responsibility, people who are not controlling their life, their behavior, since they have some they are addicted to some substances. So it is not about all the people who are getting tuberculosis, but very often, namely, such kind of people are infected with this infection, with tuberculosis. And that means that such people are more supposed to start the treatment just when the infection will become extremely severe. It will produce too much health issues. The person will start the treatment. Of course, it will produce some benefits, and when the person will start feeling better, by practice we have very often too much cases of abandoned treatment. And since we have too much cases of abandoned treatment, this is very good base, very good condition for bacteria to obtain multi-drug resistance. So whenever you are starting antibacterial treatment and you do not lead the treatment till the end, it becomes and you abandon the treatment, it can turn it into a multi-drug resistant form. After this abandoned treatment, if the mistake will be repeated, you can transform this infection into a extensively drug resistant bacteria. And after that, if you will still continue repeating abandoning the treatment, you can lead this infection to a pan-drug resistance, when there will not be any chance to treat this infection with any kind of existing antibiotics. Diphtheria. The next infection is diphtheria. This disease is caused by a pathogen Corynebacterium diphtheria, which is non-motile, non-capsulated, club-shaped gram-positive bacillus. And here you can see some pictures of colonies of Corynebacterium diphtheria and some pictures of bacteria of this smear. This smear is a staining made by Loeffler, by Albert staining. Regarding transmission, pathogen is Corynebacterium diphtheria. Source of infection is human, so it is anthraponosis. The mechanism of transmission is airborne, so it is airborne infection, and the way of transmission is air droplets. Well, the factor of transmission will be saliva or mucus from the oral or nasal cavity. Regarding clinical manifestations, there are two types of clinical diphtheria. It is nasopharyngeal and cutaneous diphtheria. The mostly spreaded one is nasopharyngeal, and this kind of infection is also the mostly this kind of infection also the mostly dangerous, since it produces more complications, and it affects not just mucous membrane, it also affects upper respiratory ways and can produce obstruction of the airway with the pseudomembrane. Regarding pathogenesis, it includes two features of this bacteria. First one is colonization. It multiplies extremely fast, and it colonizes the mucous membrane or the skin. And the second one is toxigenity. So this bacteria is producing toxins, which are making the infection to be more severe and more complicated. Regarding laboratory diagnosis, we have bacteriological investigation, which includes cultivation of bacteria in blood and telluride agar. And the feature of telluride is to inhibit other kinds of normal flora, other kinds of bacteria. So it will let just Corynebacteria growing and some kinds of other pathogens like Staphylococcus, for example. Plus, we will apply Loeffler or Albert staining, which will show us to see the shape of bacteria, and they will show us the volutin granules, which you could observe here in the picture. So these black dots on the edges of Corynebacterium don't don't misuse them with spores in other bacteria. It is these are volutin granules. They are not have nothing in common with spores. It is just a specific feature of Corynebacterium. So Loeffler and Albert staining will help us to see the shape of bacteria and to see the volutin granules in the Corynebacterium. Also, we have some specific commercial kits which allow to identify strains and biotypes of bacteria, of diphtheria. And we have matrix assisted laser desorption ionization time of light mass spectrometry. And this type of investigation is based upon the protein compromission of microbial cells, but the mostly important part of the laboratory investigation is detection of toxicity of the bacteria by ELIC immunoprecipitation test. So it will help us to understand if the bacteria has or not ability to produce a toxin, because toxicity is the mostly important part of the mostly important part of pathogenicity of Corynebacterium diphtheria. Regarding prophylaxis and treatment, first of all, prophylaxis includes vaccination, which starts in the childhood, and it includes, according to the program of immunization of your country, it can vary between 4 and 5 steps of immunization with DTP vaccine. DTP means it is a triple vaccine against diphtheria, tetanus, and pertussis, or the last one is whooping cough. We'll talk about it later. And from the teenage and during the entire life, every about 5 till 10 years, is applied vaccine DT against diphtheria and tetanus. So here you can understand that the immunity is not lifelong, and even if diphtheria is known as an infection which affects children, but also it can affect adults if the person is not immune. Regarding the treatment, of course, the treatment will require just non-immune sick patient. The first part of the treatment is antitoxic treatment, and the treatment is to be started namely with antitoxic treatment. And the second part of the treatment is antibacterial treatment. And even if we should start with antitoxic treatment, it doesn't mean that antibacterial treatment is not important, since we should eliminate the bacteria which is producing the toxin. So as soon as we will eliminate both toxins and bacteria, as soon we'll have the healthy patient. And also we have a kind of investigation Schick test. It is immunity test which is made in vivo, which means in the living organism. So the test is based on the fact that diphtheria toxin is very irritating, and from the moment you introduce it by injection intradermally to the patient, it will start producing local side effect, local irritation, unless the person is immune for this infection, and antibodies in the patient will fight with this toxin and will neutralize it. What is very important to know that that immunity which we get by vaccination is not antibacterial, but it is antitoxic. So the vaccine includes toxoid, which is neutralized toxin, and in this way our body is producing actively antibodies against diphtheric toxin. And that means even if we have immunity against diphtheria, we can have Corynebacterium diphtheria, so we can be carriers of this bacteria. This is why it is extremely important to vaccinate everyone, because if in other infections we have antibacterial or antiviral immunity, which will stop spreading the pathogen. So if the person is getting antibacterial immunity, and the bacteria is getting inside the body, the person's immunity is starting fighting against the bacteria. So the disease will not happen, since the person will not have the bacteria anymore. In case of diphtheria, from the moment the Corynebacteria is getting inside the body, even if we have immunity against diphtheria, this immunity is antitoxic. So the bacteria can multiply in the body. You can become chronic carrier of this bacteria, and you will not have any symptoms, because you will be healthy, because your immunity is providing antibodies against the toxin produced by Corynebacterium. But at the same time, if you will communicate with non-immune person, you can be a source of infection for that non-immune person. This is why, if it is possible, everyone is to be vaccinated, unless the person has contraindications for vaccination. Another infection is whooping cough. Whooping cough is another respiratory infection caused by bacteria Bordetella pertussis and Bordetella parapertussis. And even if it is considered to be, also as previous infection, considered to be infection of children, anyways, these bacteria can affect both children, teenagers, newborns, infants. It can affect also adult people. So this bacteria is gram-negative, Coccobacillus, and can be distinguished based on a number of biochemical characters. And here you can see different species of bacteria which can produce different species of Bordetella, which can produce different infections. The mostly important of them are first two bacteria, Bordetella pertussis and Bordetella parapertussis. Transmission of pertussis is as well as in previous two infections. So pathogen, we know it is Bordetella pertussis or Bordetella parapertussis. Source of infection is human, so it is anthroponosis. Mechanism of transmission is airborne, so it is airborne infection. And the way of transmission is air droplet. Well, the factor which will vehicle the pathogen from person to person will be saliva or mucus during the coughing or sneezing. Talking about pertussis, it is coughing. This disease is known in different countries, in different languages, by different names. Original name is Pertussis. The mostly spreaded naming is whooping cough. Whooping because of the specific sound is produced during the coughing. In some countries, in some countries and in some languages, this disease also is called donkey cough. And you will see next the video in which you will see the child infected with Bordetella pertussis, infected with whooping cough, and you will understand why some people, in some countries, in some languages, this infection is called donkey cough. So the clinic includes 3 phases. After incubation, it has non-specific symptoms. It's a kind of prodromal period in which we could have rhinorrhea, sneezing, and non-specific coughs. But the mostly important stage is paroxysmal phase, in which we have that part of coughing, that extremely severe coughing, which makes the patient to almost suffocates the person and the child, and it doesn't allow to the child or the infected person to breathe. So the last phase is phase of convalescence, when the cough attacks are slowly decreasing. And here you can see the video with symptoms of whooping cough.
Okay, that's okay. Okay, take a breath, Melanie. Come on. Almost there. There we go. Oh my, it's okay. It's okay. Yeah, it's okay. Here. Yeah. It's okay. Yeah. Yeah. Okay, sweetie.
Well, this video can be a very good reason for future and actual parents to consider better vaccination, to consider better immunization of their children, because there is nothing more frustrating, there is nothing more painful than seeing your child to not be able to breathe, and you know that you cannot do anything to that unless your child will be vaccinated and will be immune for this infection. Here we can see how are looking colonies of Bordetella pertussis on two different culture media, Regan Low agar and Bordet Gengo agar. Maybe I pronounced it wrong, because it seems to be a French name, so I apologize if I pronounced it wrong. But here we are. You can see the spaces of hemolysis here, and you can see in both cases whitish colonies of Bordetella pertussis. Regarding microscopic examination, typical colonies appear. We have gram staining determination, and we can apply it for both Bordetella pertussis and Bordetella parapertussis. So it will be a small gram-negative coccobacilli. So the difference between coccus and bacillus: coccus is spherical shaped, bacillus is rod shaped, but Bordetella is kind of oval shaped, something between coccus and bacillus. This is why it is called coccobacilli. Regarding prophylaxis of pertussis, we have immunization, we have vaccination with DTP vaccine. In different countries, it has different stages of vaccination, but basically it is on ages, at ages of 2, 4, 6 years, 2, 4, 6 months, 15, 18 months, and 4, 6 years. Well, even if the immunity is not lifelong, it is very important to vaccinate, namely children, because of highly exposure of the young organism to different factors, And since young organism is not able to fight good enough with this infection, so in some countries it produces too much neonatal mortality. So it is important to make vaccination. Regarding the treatment, we have antibiotical treatment of pertussis, and we have macrolide treatment with macrolides, which will reduce duration and severity of symptoms in this infection.